Māori, te whare e tu nei, tēnā koe. Nā mana whenua e tēnā koutou. He tangata tiriti aho. E noho o ki te Aotearoa i Rauro i te mana o te tiriti o Watangi. Ka mihi o ki ngā rangatira o tēnei whare, wānanga. Ka mihi hoki o ki ngā pukanga, ki ngā akonga, ka ngā kaimahi, katoa e tēnei whare wongana. Ka tua au kone he mana, tai koa i te kauhau rangatiratanga, mataronga, te mohi ko mohi, mata marama, ka matua, mata matau, ka ora, ti he mori ora. It's a great privilege to be here today. It's lovely to see friends and people. Oh, sorry. It's lovely to see friends and colleagues here and people who I really admire, and I thank you for coming out on a cold night to come and listen to me. So I'm speaking today, and thank you for the very generous introductions, because housing is very important to me. I see it as a fundamental human right to live in a warm, dry house. And I cannot see why a relatively wealthy country like ours can't do that. And so that's what I and all the people who work with me are committed to. So I chose the title Speaking Truth to Power and the impact of research on population health, because I'm part of a department which is committed to this in various ways, and I'm going to use examples from many of them. Now, I'm starting off because I think speaking truth to power is a concept that has been really important from the days of classical Greece, for the Quakers, from the civil rights movement in the States, where the phrase first came from, Hindu, from Islamic culture, religion, and also from Māori or Rangi Māori. So it seemed a good and responsible thing to speak to power as much as, and to present the views of public health, which have become somewhat mooted at the moment. So, okay, thank you. Is that better? Yes, thank you. Okay, the choices for those with less power, Hirschman, a very famous political philosopher that I've had many pleasant discussions with Jeff Vergier about, said in terms of the choices that individuals have, they can exit, they can leave, they can give voice, or they can show loyalty. Well, I've shown loyalty for 30 odd years, and now I'm using my voice as widely as I can. So speaking truth to power, I think it's really important to define moral responses to problems and the case for informed public policies and critical institutions. Robust research evidence can either support proposed policy or question its effectiveness. The evidence base for policy decisions needs to be published and available. And those of you who are interested in what the current organisation that I've just been required to leave, I suggest you try OIA, which gave evidence as to how our large state housing organisation actually functioned. So the evidence base for policy decisions needs to be published and available, and that's why I suggest you use OIA for that. Researchers need funding to illuminate important public questions. And as my colleagues have reminded us, the university statutes formally encourage teachers and researchers to be the conscience and critic of society. Now, there's a lot been had about social investment, but here I'm talking about population health, which means more than an individual or a family. And we've had a reputation for social reform at a societal level since the 19th century. And we've made big changes in social, economic, environmental and cultural determinants of health, which are the ones that systematically shape population health. Te tiriti is critical to improving Māori health, reducing inequalities and fostering an inclusive society. So as I said, that's what population health is based on rather than individuals. And also that it has to be timely and available for public scrutiny. And also something now that my group, Neville and Pearce, Professor Neville Pearce and my group is focusing on, outcome measures for health and well-being must be regularly monitored to determine the effectiveness and equity of policies. Now, my father-in-law was a professor of politics, Professor Robert Chapman, and he has a wonderful lot of books going back about New Zealand politics, including these ones by former Prime Minister William Pember Reeves, State Experiments in Australia and New Zealand. And this goes through areas where New Zealand, and to a certain extent Australia, though he starts off with New Zealand, passed laws, regulations that put us ahead of most other people. The women's franchise, of course, labour laws, factory laws, minimum wages, industrial arbitration. Wish we could go back to that. Unemployed and state employment, where we followed the Bismarckian German government, old age pensions and liquor laws. So we've done it before and we can do it again. And there's a clear focus for those of you who don't live, sleep and dream public population health. It's an upstream policy. We don't wait till children end up in hospital, people get killed on the roads, people are cold in homes. We try and prevent the problems. And the quality and affordable, secure housing to prevent homelessness has become one of our foci. Compact urban design to present urban sprawl. And my daughter in New York, if she can stay awake this long, pay tribute to her who's doing that in Manhattan, providing a lot more public spaces on the roads and doing a very good job. Now, a lot of these things to do with housing and roads and transport lower carbon emissions. If you build houses that are to a higher quality, and I'm going to talk about this later on, that's where that and the energy that's used around it is about 12% of our carbon emissions, 12 to 20%. If you add transport, how you get to and fro to here or to education or to work, that's another 40%. So over half of our carbon emissions actually come from the two things that we're mainly concerned about. I'm going to give two examples talking from acknowledging the work of my colleagues. One, precautionary measures to prevent the spread of epidemics, where Professor Michael Baker and Professor Amanda Klausvik and many other people have worked on that, showing that if you follow the evidence, you can save lives. And then I come to a rather distressing example where we know very clearly that we can save lives, and because 5,000 people die each year from smoking tobacco, but the current government chose to ignore that advice. Now, I'm not going through all the evidence individually. If you want to follow up and interested, we got a request, which we were very humbled by, from the Annual Review of Public Health, asking us to write on the review of the impact of housing quality on inequalities in health and well-being. And that Julie Bennett, who's done a lot of the work on indoor environment, Richard Edwards, who's leads with other people, the tobacco one, Dave Jacobs, who's a colleague who's done a lot of work in the US, and David Ormandy, who helped us to warrant of fitness in New Zealand and sadly has just died. I'd like to acknowledge him. This is the group which has been actually extended a lot since 2009, but many people are still in the group. And that continuity of experience and working together, I think, is really critical. So partly as the result of what we used to do, which was randomized controlled studies, I was asked to chair the WHO Housing and Health Guidelines, and the acknowledgement of how long it took. It took at least 5 years. Those of you who've been involved with the WHO, they're really, really careful that you don't have a conflict of interest, and they really, you have to reach the highest standards of evidence. And this was launched in Kampala for the Northern Hemisphere, and we launched it here in 2018. They do very systematic reviews to find out what the top evidence is, and our research appears in all these areas. Healthy housing should not be crowded, not be too hot, not be too cold, not damp or mouldy, not polluted, and have no fall hazards. So that has influenced policy around the world, which we're really delighted about. I'm talking, I've said I'm not talking about individual people, but I'm also not talking about our individual research group, because I think organisations and the institutional rules that they run under are really, really critical in a democracy. So we have been funded since 2009 by competitively public funded research grants, though we're all rather nervous at the moment about what's going to be happening in this area. The University of Otago has, until recently, we've been a centre of excellence, and we're a World Health Organization collaborating research centre on housing and wellbeing. And these below are the main points that we concentrate on. We meet every week, and then we have away days to make sure we're on the right track. And so we want to improve health and well-being outcomes, reduce social and economic inequalities, improve the quality of rental housing, balance power between tenants, landlords and their agents. This has become a very important issue for us. Reduce homelessness and support housing first. Support sustaining tenancies, which have just disappeared in the first 100 days of this government, to reduce evictions, and evaluate different ways of providing public and affordable housing. Increase Maori and Pacifica home ownership, that has also gone in the first 100 days, home ownership, and reduce carbon emissions through quality of housing and urban form, which I mentioned before. So that's quite a list. We try and concentrate a lot, and as I say, many of us agree that housing is a human right. And one of the first, we usually have summer schools, which I hope that some of you can come along to in future. And we usually write books from that with the contributions from everyone. This was one that was edited by Sarah Bear, who's there in the audience. We identified very early on that there was an inadequate supply of housing, affordable housing, because of course in the market, you don't try and develop an affordable project. You're trying to maximize profit, and the two are somewhat incompatible. So upscaling of affordable housing requires both central and local government intervention, and the importance of sustainable partnership. I should have mentioned before, those were the people who are directly employed in our group, but people like Arthur Grimes here, who is in Motu, there's a close colleague, Len Cook, who works with us, and I will mention other people's names as we're going along. And Guy Penny, who is, leads the Mātauranga strand of our current research. Their relationships is the key of that Mātauranga Māori. When at the Royal Society, I spent ages also chairing the spotlight on housing, which was not a very pleasant experience. It was very slow, but in any case, we updated what data we knew. There's been a rise in renting, and we're now 35% of households are renting. And it was because of that, and because we know that private rentals are in poorer conditions, and that's a consistent finding in all research. That's what we've been focusing on. There's limited regulation of private rentals, and one of the things that, 2 or 3 things that we're most proud of is we developed, Sarah and Lucy and other people helped to develop a rental warrant of fitness, which made we were able to distill what are the key things that we need to do to make homes healthier. Then the Labour government came in and set up the Healthy Home Standards for rental housing, and so that was one of our real collaborations that grew fruit. Now, we were able to say what we thought were the critical aspects of improving housing, both for individuals, for whānau and for population health. Retrofitting insulation and heating, we worked with ICA for this. Reducing indoor nitrogen dioxide, the other thing we're proud of, something like 60% of households in New Zealand used to have unflued gas heaters, which pour out all this poisonous nitrogen dioxide, and then people are still using them in caravans, and we regularly have people dying of the carbon monoxide. Ventilation, which I'm going to talk about because there's new evidence coming from this. The mould, household crowding, home injuries, which we're still working on. Michael Keel here has led that work on how to make structural improvements to stop people falling and injuring themselves or killing themselves in the home. The home is the place where most ACC claims are made, and yet we didn't manage to get that in the Healthy Homes Standards. Now, I'm not going to go through all these. That would be a bit tedious for many people. So when we got the Rutherford Medal, they asked us to summarise our evidence, and so everybody in the group was involved, and you'll be able to see it goes through those if you're wanting to know the evidence for those factors. The only one I'm including now is work done by Caroline Haley and Julian Crane on ventilation. Because when COVID came along, Caroline had been working in this area for a long while. When COVID came along, if you remember, there was the view that you touch surfaces and the virus was around on the surfaces, and that's how you got COVID. And I'm going to come on to say that later on. We managed to get this into the Healthy Home Standards because it's important for keeping homes healthy by refreshing indoor air. When I realised that actually COVID was largely airborne. For keeping homes healthy by refreshing indoor air, removing moisture, air pollutants, and reducing viral transmission. And this is somewhere where success does depend quite a lot on occupant behaviour and building factors, which we can do something home. And our homes are becoming more airtight, our weather and ventilation practices are changing. Incorporating sufficient and smart ventilation critical to keeping homes healthy is really critical. And there's this really nice quote from that Caroline Haley found. Open the window of your mind, allow the fresh air, new lights and new truths to enter. And Julie Bennett has also worked a lot in this area and now in schools. And these are results from a home study we did, housing outcomes. And you can see here, we don't ventilate very well in winter. And daily bedroom ventilation, the M here in home stands for mould, that lowered the amount of mould in houses. And those of you who filled in the census, you'll know that there was do you have more than A4 size mould in your house? Well, this is one reason, apart from having insulation and heating and so forth, opening windows is very critical for that. And we looked at the relative odds of increase in mould score on the right-hand side here. The frequency child's bedroom ventilated. The odds actually of relative to we were looking actually at wheezing and so forth, and the more air that there was circulation, the better that it was. So with these rental warranted fitness, this was our first really big win, and rental housing had previously been regulated by the 1947 housing regulations, which is a long time, and houses have changed quite a lot. So in a paper that Sarah wrote with her lawyer husband and me, we showed that this was really important. And there was an underinvestment by landlords in improving housing, And the compulsory healthy home standards that were introduced in 2019, and includes smoke alarms too. This all basic community housing and also Kāinga have completed this by the due date given in it's by June 2024. Kāinga is up to 99.4. Some people are very reluctant to have builders coming into their homes. Now the big gap here was boarding houses, which Claire Aspinall had pointed out, and Kate O'More when we were in select committee, was a real anomaly, and that was years ago. And we've seen the terrible consequences of that in the Loafers Lodge. So, a year ago now, and there was recently been another one in Auckland, and the latest going around found that 30 of the boarding houses didn't meet the healthy home standards at all. So we have huge gaps, and particularly for the people who have got the least resources. Now, that question mark is to remind me to ask you a question. I'm now going to come on and talk about public and community housing. So I'm going to ask you, and I've actually given the answer in an earlier slide if you were noticing, but what proportion of New Zealand houses do you think there are in New Zealand? So this is community and state houses, which I will continue to call them state or public housing. Okay, well, I'm going to say, put up your hands if you think it's under 30%. If you think it's pretty well-informed audience. If you think this is my favourite party trick, by the way. If it's under 20%, oh, very good. Under 10%, under 5%, yes. It's 3.8% of housing in New Zealand is public or community. And if you saw all the articles saying how ghastly tenants are and trying to make them sound totally unpleasant, that is an incredibly small proportion of the 72,000 households in Kāinga housing, and about a third of that in other housing. So I think there's a lot that the public doesn't really understand about this. There we are. This comes from the OECD, and you can see New Zealand here, here going up here. And you can see this is the colour that we're looking at here. This is rental, private rental, and right at the top here is subsidised. So we're very small compared to Australia and many of the other countries there that you will see. So we're looking at the line, this dark blue line along here. So Denmark, you see, has quite a high proportion. Iceland does. Norway doesn't, has a higher amount of rental. And so it goes on. So we're anomalous about what small proportion we do have. So I should acknowledge that for the moment I am on the board of Kāinga, but I'm about to be evicted, like many tenants. So I thought while I have an opportunity, I would just briefly update you about public and community housing. The first thing to say is really the last point here. You would think if you listened to the radio that Kāinga and community houses were at each other's throat. That is not the case. We work very closely together as we see that both are important. And iwi housing there too. Okay, so the Krane they used to be Housing New Zealand Kāinga, and it was deliberately by the government called Homes and Communities, because we recognised you just didn't want to plonk houses places, you wanted to have a community around them and an inclusive community. So it was very innovatively funded for infrastructure and construction. We're not the Ministry of Works. We don't have our own workforce. We actually work very, very, very close relationships, civil engineers, builders, iwi, and in fact, we had a role in being counter-cyclical to the ups and downs of the building sector. And that's another thing that's gone in the 100 days, the underwriting, which means you don't actually give money, but you say, yes, this is a housing that we value, it's to the standard that we want, which is above code, because we haven't had a renewal of code for ages, and so we'll underwrite that. Since the beginning, in the last 6-year public housing plan, we've built 8,872 public houses above code. 15% of them are universal design, and there are almost no private rental houses with universal design in them. So we have 72,000 houses, about 185 tenants. In the whole period that we've been going, 14,000 houses. In fact, the building of public community houses at the moment is the largest since this building began during the Depression. And we're on track to build another 3,500 homes this year. Now, I put this Rolleston here because those of you know Rolleston's in Mount Cook. It's an absolutely beautiful development, and I had the privilege of turning the sod for 4 years ago. And then right at the last moment they said, okay, you launch it, because you were there at the beginning. And it's high quality, it's got a community room, it welcomes the local community in Mount Cook. Anyone from Mount Cook here? No, okay. And there's a barbecue that they can go and use, and it's working very well. And it's the site of the old pā site for one of the Taranaki tribes, and there's a lot of acknowledging that in the design of it too. We do large-scale urban development plans. This is one in Highbury Triangle at Avondale for older people. It's based around green gardens. Do you know what they think older people are? I'm rather insulted by it. It's 55 plus. It's considered at that time that you won't cause trouble and have too many parties, and so apartments will be okay. Very exciting, where there's about 5 of these large-scale plans going. And 4 years ago, I had been sick of seeing that diagram which shows Labour builds housing, the government comes in and sells them off, build again, sells them off. And we said, we've got to get some evidence here. So along with colleagues like Arthur and people from Teresa Wall, from Guy Penny, a whole lot of other different organisations, we said we're going to have to measure this and look and see what's happening. So it was a big Endeavour grant, and we're comparing the approaches on Mātauranga Māori, governance, quality of housing, how much energy is used, what transport people use in those, and what tenant and community wellbeing is. Fundamentally, most of the houses are medium density, which has become, because people don't want to sprawl out and create more carbon emissions. Most of the people actually use that. And these are the 7 different state and community providers that we're looking at. 2 of them are very large development, one in East Porirua and one in Tamaki Regeneration. We work closely with the Salvation Army, with Dwell. Is Claire here? Oh yeah. Oh, yeah. Oh, yes, Claire, and yes, hi. Dwell is here, thank you very much. Ōtākou, which was the Christchurch City Council Trust, Te Toi Mohana, which is the Wellington City Council Trust. These councils move towards being trusts because that way they can get income-related rents. And I should tell you, those of you who don't know, the government funds exactly the same level, public housing and community housing, that they're funded with the income-related rents, and the organisations can use that money knowing that they've got a stream of funding coming in. And when a new 3,000 was announced just before the election, that was divided between community houses and Kāingaora. And the Wainui and Mata Marae Trust, which is very dear to my heart, with my friend Cheryl and colleague Cheryl Davis. She reminded me the other day, we've been working on getting Papa Kāinga housing for 18 years. And it looks like it's just about to go through, so that's been very, very exciting. Now this is very essence only of it. Arthur, I thought we were going to, I might had too many words on this now. Arthur is, we did a wellbeing survey of all the people, the 650 people in those houses, a mixture of public housing, all those different kinds, and some private housing and some home ownership. And Kim led the team that put that into the field. It was done very efficiently. We got the results, and Arthur presented this last year at just before the election. It was well received in an economics conference there. Tenants in public housing and community housing have, this is the final line of it, have similar levels of well-being as homeowners, despite the differences in incomes. Now we think this is because the stability there, because in fact their rents are reduced, unlike the large proportion of low-income people who pay 40% of their household income in rents. So that was contrary to what was considered, and that's what we hope from this big research we're doing. We'll be able to find out what the facts are and have strong evidence. Now, this, let me check, yes. So, I've spent a lot of time recently with a grandchild in New York on seesaws. So I've been looking for metaphors that I haven't used before. And so I'll tell you what the secret of this is. Before 2020, landlords had several legal options to end tenancies, including, after 90 days, a no-cause notice. And a lot of people contacted our group one way and another, where they were just given notice and they couldn't find anywhere else and they were outside of their neighbourhood. It's particularly distressing and stressing for people who've got young children, but also for older people who know their neighbourhood very well and rely on companionship of people around them. And from 2021, these legal options for landlords were removed. The policy of sustaining tenancies was introduced by the Ministry of Housing and Urban Development, and notice periods for reasons to end a tenancy were lengthened. And this was the Residential Tenancy Amendment Act in 2020. And we supported that, Renters United supported that. Some landlords didn't. But some did, I have to say. In 2024, a proposal was made to repeal the Residential Tenancies Amendment Act 2020 and reintroduce the Residential Tenancy Act 1986 with 45-day no-cause eviction clause. So it's been reduced, it's a bit worse than the one before. It's a much smaller period. Now, the seesaw comes in it because if you know where you are, you're home and housed and homed. So you've got your feet on the ground down there. If you're up here and you've been evicted, you're homeless, you're in a really powerless position. And I was shocked to see the other day, I came back and told my group, I saw a woman I was coming back from a late night event and there was a woman in labour on the street. So, I mean, walking a lot on Lambton Quay is not the same way as it used to be. Homelessness. So this is the work that Neville and Ellie and Ginny Ombler and our group have picked up, and it's following work that was done by Helen Biggers here and Kate Amore, looking at severe housing deprivation. We didn't really like calling people, oh, you're homeless. So we looked at the measures of what we knew were important about housing, and that's crowding. Lots of people in crowded houses, and we know where this becomes very important in COVID. The substandard housing didn't have electricity, so that's where you get the terrible things where children are killed because they're using candles at night and then the candle tips over. No portable water, people who are actually on the street, and the invisible people that you don't notice. This will be available if anybody who wants it, and I put the articles at the bottom there. Now, about the time when we were, about 5 years ago, Neville and his colleagues in the group applied for to introduce, see how housing first worked. Now, Housing First comes from Canada, and the idea is forget about whether someone's drinking or behaving or not behaving. Get them housed first, and then they can stabilise down with lots of support. And it's been very, very effective. At first it was funded largely through charities and trusts, but now the government has funded it, and Claire Aspinall's just finished her doctorate on it. That after 5 years, we've looked using the IDI, and we found that once people were housed, they had a rise in income from both benefits and paid work, although their incomes were still low, but significant improvements. There were big drops in hospitalisation and injuries, initial rise, then a small drop in outpatient services, big improvements in mental health, and drops in justice interactions. So that's very, very heartening to see that, but those people, Neville and her team have been working closely at that, have already been getting that feedback from people. Now, sustaining tenancies. Well, I have to tell you where this picture comes from. I'm always looking for public art, and this is in the railway underground, just below where the city is in Manhattan, and there's a wealthy person picking up all the coins. Sustaining tenancies, which was to provide stability and better health and well-being for whānau, particularly for children and older people, and we absolutely agree with that. Tenure security, I've already mentioned, has multiple social and health consequences, and Kim Nathan worked with us looking at the number of times that children moved. Did it have any impact on them? Yes. The more times they move, there's a linear relationship with their socio-behavioural problems. So, you know, if we don't get enough housing, there are consequences that we know. Now I'm going to come to two positive examples here. This is a modification of one of Michael and Amanda's work. This was an evidence-informed strategy formulation for what we need to do to make sure that we don't have the deaths that were occurring elsewhere for COVID. So it was adopted on 23rd of March 2020 with a decision to pursue the rapid lockdown. Now the thing where evidence was important here, there had been less than 100 cases in New Zealand. There had been no deaths. So this was anticipatory policy making, which I think was really, really critical. Evidence about, also related to it, the evidence about impact of crowding and ventilation helped to broaden what the safe spaces were. For example, in New Zealand, we were allowed to walk outside in parks and walk around. If you were in China during the period when they had lockdown, you weren't allowed to leave your building. I think the evidence that we had was actually very important, and also with insistence of lots of people, the recognition that we know where the crowded households are, and there was a big effort made to, I should have mentioned Nick Wilson, who was involved in all this too, Professor Nick Wilson, the recognition of where the crowded houses were and the whānau increased the collaborations with those communities, and was once that whole thing got going, that based on previous work that had been done, Mises and Rabella and so forth. And we should be extremely proud of this, and we should all go along and watch the drama of it at the Circa Theatre. So that I also wrote a book with 15 people who are in my International Science Committee about it, but I thought we'd used Michael ones here. This is comparing excess mortality. Of course, people are dying all the time and being born all the time, but this is the excess one that you wouldn't expect. And you can see here at the bottom, at the bottom, which is, just a minute where I've lost that. At the bottom here, which you wouldn't normally like to be at the bottom, but here, here you can see that means that actually we had less deaths during COVID than we would expected, and only a very small number of deaths compared to Taiwan, which started off doing very well, but then not so well after. We were miles ahead of Australia, and the United Kingdom and United States were disasters compared to us. So we can thank the government and the population that followed their rules until they didn't, for saving lots and lots of life. A hugely smaller amount. Now, I'm coming to an end, and I'm sorry I've got a very unhappy example here. It's a U-turn in the wrong direction. This is policy changes without evidence. And if you don't follow population public health advice, it costs lives. Maybe you could take a court case. Now, the smoke-free legislation, in the words of Richard here, Janet Hook, Jude Ball, who helped me with this, and Anaruwa, is evidence-based, but removing it is not. And when I escaped from my lovely little grandchild, I went around the Whitney Museum of Modern Arts, and I hadn't seen this Klaus Oldenburg sculpture. It's about this high, it's huge. And you walk into the room, and at the side it says, "The work suggests a critique of an American vision of boundless consumer goods and the bodies required to consume them," which I thought was a nice touch. So very sadly, 5,000 people die from smoking-related diseases each year, 5,000. And the work that this group did, Aspire, was based on introducing smoke-free environments and regulated products. Amendment Act was based on extensive national and international research. It was covered widely in The Guardian and the New York Times because it had three policy measures: denicotization of cigarettes, lowering getting rid of the nicotine in them, and tobacco, large reductions in outlines selling tobacco, and the most innovative, inspirational was that we were going to have smoke-free generation. And in 2024, the coalition was repealed by a government who had numbers of people who had strong connections with the tobacco industry. So it wasn't exactly evidence-free, it was evidence-free of public health advice, but not the industry. Now, I noticed, just as an upturn from this, the government does have inconsistent policies. There's a prohibition of restriction versus acceptance. When I was looking at the 2024 repeal of the Smoke-Free Act amendment to the Residential Tenancy Act, I noticed they had a clause in it prohibiting smoking inside rental properties to further support landlords and improve the clarity and effectiveness of the law. And the reason why they said that is that the justification clarifies that clauses in tenancy agreement that prohibit smoking indoors are enforceable, as if they're not elsewhere. They just require organisation and commitment. And I was pleased to see that the coalition government's agreements declared decisions will be based on data and evidence. So I'm going to just finish off by saying there are some very important policy tools. And I'd like to acknowledge Len Cook here. We use the IDI, the Integrated Data Infrastructure, which every time you go to the doctor or you get a traffic fine or something happens to you, that gets recorded against the number, your IDI number in Statistics New Zealand. And under very strict conditions in special laboratories, we can access and know how many times you've seen the doctor, when we've been to hospital, and so forth. And it enables monitoring outcomes in real time. Some groups are poorly represented. So some people are worried about that we're relying on this IDI. But it does allow us to calculate the impact of new policy and what happens when they're extended or summarily reversed. So watch this space, we're very active here. Now, as Len Cook has reminded us, this is administrative data. And some people don't go to the doctor as much as they should, or they don't. So the census is the only count we have of the whole population. It monitors demographic dynamics and enables integration of bits and pieces like the IDI into the whole population. And census data is critical to estimate population changes from birth rates, immigration, and immigration flows. Many of you will know the reason we got behind in housing is that we don't really have a population policy, and we open the doors when we think we need more labour, when nobody thinks about schools and housing for them. The threatened elimination of a 5-year census data, and of course Lynn Cook has been the head of our Statistics New Zealand and of the UK, our only national data set would create major gaps in our knowledge of equity and inequalities between populations, what is happening to them. There's a serious lack of evidence about the scientific and social consequences of this. High costs of uncertainty and lack of preparedness haven't been considered. And this is just extends what I've said before. You do need a population phenomena at national and regional levels. And we use the census to develop the severe housing deprivation and to work out where there is a shortage of housing and therefore where you need to build. Now, just concluding, the final way where we don't understand when policy is heading in the wrong direction, climate change. There is abundant evidence now about the reality of climate change. We are sweeping past the 1.5 warming guardrail and failing to achieve even the upper level of the 1.5 warming threshold. Going above 2 degrees would be disastrous. To stay below that level, countries need to strengthen their ambition, make their nationally determined contributions. We're yet to see what the current government's going to do. Under the Paris Agreement are supposed to be more ambitious. New Zealand's Paris target includes making a 50% cut in national emissions below 2005 levels by 2030 and methane 10% by 2030. New Zealand is not on track to achieve this given recent policy changes. Better informed policy is urgently needed. Climate is already affecting housing and health. And this is a graph that was recently published in The Guardian, just highlighting, this actually goes back from a very Copernicus, which is a very good source of data, and goes back to 1940, and you start to see as industrialisation increases, this average goes up. The first days we were above 1.5 degrees. We're in 2015, and in February this year, the first time we've had 4 consecutive days above 2 degrees. This is looking very much like an exponential curve. And so building houses in the proper places, not just putting them in greenfield sites after you've asked your favourite politician if you can do it, is going to be a disaster for the climate. Okay, time to finish. In conclusion, thank you for being such a receptive audience. Housing and urban regeneration are the key to the determinants of well-being. We have to think about social factors, economic factors, cultural and environment, and there are broad systematic co-benefits. There's importance in reducing inequalities by raising standards. Regulations gets a bad brief in some quarters, but actually we need more of it and we need it better implemented. Sustainability of public and community housing is absolutely critical. We cannot leave it to the private market or to private finance, because it'll soon become then private property. It's very important that research underpins policy and important that outcomes of policies are closely monitored. And finally, my overall conclusion is robust evidence, which is listened to, is vital for good government. So thank you for your attention. I hope I've left time for questions, because I really...